CheckMate 459 is basically a global, open-label, randomized phase 3 study in assessing the efficacy and safety of a single-agent Nivolumab versus a single-agent Sorafenib as first-line treatment in patients with advanced hepatocellular carcinoma. So we enroll patients with histologically confirmed hepatocellular carcinoma. They should have a good liver function, good performance status, and they should be systemic therapy naive. And then we stratify the patient according to 3 main stratification criteria. First is according to the underlying etiology. Second is according to the geographic. Third is according to whether the tumor have any vascular invasion or extrahepatic spread. And then we randomize patient in 1-to-1 ratio. Half of the patient receive Nivolumab, another half of the patient receive Sorafenib until toxicity or disease progression. So the primary endpoint was the overall survival. Secondary endpoint were progression-free survival, response rate, tolerability, and also the relationship between the PD-L1 and the efficacy. And also we have health-related quality of life as exploratory endpoint. So the recruitment period was basically from January 2016 to May 2017. And the current analysis was based on the database lock done in June this year. The main result of the CheckMate 459 it shows that if you use Nivolumab as the first-line treatment, in our result it shows that the median overall survival was around 16.4 months. It is the highest first-line OS we observe as first-line treatment in an advanced HCC population so far. In contrast, if the patient was put on Sorafenib, the median OS was 14.7 months. Surprisingly, we find this high OS compared to all historical phase 3 Sorafenib trial. So it give rise to the hazard ratio 0.85. P-value was slightly insignificant with a p-value 0.07. However, we clearly see a lot of clinical benefits. In terms of the response rate, we see a more than doubling response rate for the patient in Nivolumab arm than Sorafenib arm, especially 4% of patients in the Nivolumab arm can achieve complete remission. Also, when compared the toxicity between 2 arms, patients on Nivolumab that they tolerate the treatment much better, and then it leads to it translates into a better quality of life in the patient. So in the CheckMate 459 in the presentation, we show you that during from the baseline until the end of the treatment, majority of the patients on Nivolumab they did not complain a significant drop in quality of life. In contrast to the patient on Sorafenib, they have majority of the patients they complain of worsening of quality of life. So taken together, we think the first line use of Nivolumab confers good clinical benefit for the patient in terms of survival, response rate, tolerability, and also the majority of patients have improved health-related quality of life.